Do you believe that being overweight automatically means you'll develop diabetes? This is a common myth many people hold on to. Yes, carrying excess weight can be a contributing factor to diabetes, but it's not a definitive sentence. Not everyone who is overweight or obese will develop diabetes. On the flip side, individuals who maintain a normal weight or are only slightly overweight can also develop this condition. It's a complex disease influenced by a variety of factors, not just weight. What's crucial is the adoption of a healthy lifestyle. This includes making nutritional changes and engaging in regular physical activity. These steps can help in shedding excess weight and subsequently reduce the risk of diabetes. But remember, it's not just about the scales, it's about overall health, so don't let the myth mislead you. Remember, being overweight increases your risk, but it's not a guaranteed one-way ticket to diabetes. Have you ever thought that eating too much sugar causes diabetes? This is a commonly held belief, but it doesn't exactly paint the whole picture. Let's delve a bit deeper. When we consume food, our bodies convert it into a form of sugar known as glucose. Glucose, or blood sugar as it's often called, serves as a vital source of energy for our bodies. This energy isn't just handed over though. It needs a key to unlock it, and that key is a hormone known as insulin. Insulin is like a little helper moving glucose from the bloodstream into our cells where it can be used as fuel. However, in the case of diabetes, this process doesn't work as it should. Either the body doesn't produce enough insulin, or it doesn't use it effectively. As a result, glucose stays in the blood, causing blood sugar levels to rise. It's important to note that sugar itself doesn't cause diabetes. What sugar can do, however, is contribute to weight gain, especially when consumed in excessive amounts or through sugary beverages. Being overweight is a risk factor for developing type 2 diabetes. So, while sugar isn't the direct culprit, it can be part of a chain reaction that leads to diabetes. Now, this doesn't mean you need to ban sugar completely from your diet. It's all about balance and moderation. Your body needs a certain amount of sugar for energy, but too much can lead to weight gain and other health issues. It's also crucial to remember that there are different types of sugars. Natural sugars found in fruits and vegetables come packed with fiber, vitamins, and minerals. On the other hand, added sugars found in cakes, cookies, and sodas provide calories but lack nutritional value. So, while sugar itself does not cause diabetes, it can contribute to conditions that increase your risk. The key is to maintain a balanced diet, stay active, and keep a healthy weight. Remember, moderation is the secret to a healthy lifestyle. Do you think a diabetes diagnosis means a lifetime of special diets? This is a common myth that many people believe, but in reality the story is quite different. The concept of a diabetes diet is outdated and misleading. People with diabetes eat the same foods that everyone else eats. There's no need for separate meals or special foods. In fact, the American Diabetes Association has moved away from recommending specific amounts of carbohydrates, fats, or proteins for those with diabetes. Instead, they encourage a balanced, healthy diet, which is beneficial for everyone, not just those with diabetes. So what does this balanced diet look like? It's about getting your carbohydrates from vegetables, whole grains, fruits, and legumes. These foods are not only packed with essential nutrients, but also have a lower glycemic index, meaning they release sugar slowly into your bloodstream, preventing spikes in blood sugar levels. But it's not just about what you should eat, it's also about what you should limit. Foods high in fat, sodium, and sugar should be consumed in moderation. These foods can lead to weight gain and other health issues, which can complicate diabetes management. However, this doesn't mean that you have to give up your favorite foods completely. It's about portion control and balance. For instance, if pizza is your weakness, you don't have to give it up entirely. Instead, pair a slice with a large salad to balance out the meal. If you've been diagnosed with diabetes, it's important to work with your healthcare provider to develop a meal plan that works best for you. Everyone is different, and what works for one person may not work for another. Your meal plan should be tailored to your individual needs, dietary preferences, and lifestyle. Remember, managing diabetes is not just about diet. It's also about regular physical activity, stress management, and regular checkups with your healthcare provider. So let's put the myth of the diabetes diet to rest. A balanced, healthy meal plan is not just for those with diabetes, but for everyone. It's about making healthier choices and finding a balance that works for you. After all, good nutrition is a key component of overall health and well-being. A balanced, healthy meal plan is not just for those with diabetes, but for everyone. Scene script. Can you imagine a life without sweets? Is that the reality for people with diabetes? Often there is a misconception that if you have diabetes, sweets become an absolute no-no. But guess what? That's not entirely true. People with diabetes can still enjoy sweets, but the key lies in moderation and proper planning. Sweets are packed with simple sugars which cause a spike in blood glucose levels more than other types of food. However, they're not entirely off limits for those with diabetes, so how can someone with diabetes safely enjoy sweets? Well, it's all about balancing. Sweets can be saved for special occasions or used as a treat rather than a regular part of your diet. It's also important to remember portion control. Smaller portions of sweets, enjoyed mindfully, can still be part of a balanced, diabetic-friendly diet. Furthermore, when you do decide to indulge in a sweet treat, it's smart to replace other carbohydrates usually eaten at a meal with the sweet item. This helps to keep the overall carbohydrate intake in check, avoiding a sudden spike in blood sugar levels. For those taking insulin, there is another factor to consider. Your healthcare provider may instruct you to adjust your insulin dosage when you eat sweets. This is because sweets can cause a rapid rise in blood glucose levels, and a higher dose of insulin might be needed to compensate for this. It's also worth noting that not all sweets are created equal. Opting for sweets with a lower glycemic index, such as dark chocolate or fruit, can be a better choice, as these cause a slower rise in blood sugar levels. In conclusion, living with diabetes doesn't mean bidding farewell to all things sweet. It's about understanding how sweets affect your body and planning accordingly. So yes, you can still savor a sweet treat, but keep in mind the mantra: moderation and planning. So having diabetes doesn't mean you can't enjoy a sweet treat every now and then. Does using insulin mean you've failed at managing your diabetes? Let's unravel this myth. People with type 1 diabetes must use insulin because their body no longer produces this vital hormone. On the other hand, type 2 diabetes is progressive, meaning that over time the body's insulin production decreases. Therefore, lifestyle changes such as exercise and diet adjustments, and even oral or non-insulin injectable medicines, may not always suffice to maintain your blood sugar levels. In such instances, insulin becomes necessary to keep your blood sugar within a healthy range. Remember, insulin isn't your enemy or a symbol of your inability to manage diabetes. On the contrary, it's a crucial tool that assists your body in regulating blood sugar levels, thus keeping you healthy. So, let's put this myth to rest. Insulin is not a sign of failure, it's a tool to help manage your blood sugar and keep you healthy. Is it dangerous to exercise if you have diabetes? This is a question that has been on the minds of many people. But the truth is far from it. In fact, regular physical activity is not just safe, it's one of the most effective ways to manage diabetes. Let's start with insulin. Insulin is a hormone that helps regulate the amount of sugar in our blood. The problem in diabetes is that either the body doesn't produce enough insulin or the insulin that is produced isn't used effectively. This leads to higher levels of blood sugar, which can cause a range of health problems. That's where exercise comes in. Physical activity increases your body's sensitivity to insulin. This means that your body can use the insulin it produces more effectively, which helps to lower your blood sugar levels. Regular exercise can actually reduce the amount of medication that people with diabetes need to manage their blood sugar levels. But the benefits of exercise don't stop there. Regular physical activity can also help to improve your body's A1C levels. A1C is a test that gives a snapshot of your blood sugar levels over the past 2 to 3 months. It's a key indicator of how well your diabetes is being managed. By helping to lower your A1C levels, regular exercise can reduce your risk of developing complications from diabetes. Aim for a goal of about 150 minutes of moderate to vigorous exercise per week. This could be anything from brisk walking to swimming, cycling, or dancing. The key is to find an activity that you enjoy, so you'll be more likely to stick with it. And remember, it's always a good idea to check with your healthcare provider before starting a new exercise program. Exercise isn't a danger for those with diabetes. In fact, it's a powerful tool in managing the condition. So lace up those sneakers and get moving. Your body will thank you.